Okay, good morning. So we've heard something about the outcomes, and now let's see something about the benefit of these outcomes. In this session, we will hear something about how the outcomes actually benefited the agency and that implemented them, either outcomes in terms of scientific and integrative outcomes, or maybe the outcomes of the simulation exercise or possibly also of other activities of the consortium, advocacy activities, workshops, or something else, or maybe simply the benefit of being involved in such a cross-sectoral network. So because we are running a little bit late, just a few words on this session. We'll have three parts, and in the first part we will hear something about from our stakeholders' agency's point of view. Then we will move and we will hear something about the outcomes of the simulation exercise that we have held. And then at the end, something on the workshop on the institutionalization of One Health that we had last June. So because the clock is ticking, I would like to welcome on stage our first speaker, Stef Bronzwaer, who's research coordinator at EFSA. Stef, the floor is yours. And we won't have time for questions in this session. Please.
No time for questions.
Unfortunately, we are too late. Sorry.
Bonjour, good morning, everybody. Thanks for the invitation again to be here with you to speak about the impact. We heard many times that, in fact, the OHEJP aimed to deliver outputs, deliverables, tools to support the implementation of One Health, and we saw some examples this morning. Not only used for the stakeholders involved, but also for the agencies, both at EU and national level. And you did. You did deliver. So compliments to ANSYS, compliments to the whole team. Very well done. We, EFSA, were involved in a number of research projects. I won't go through them all. For sake of time, I'll only mention 4 of them. First of all, Orion. I mentioned already yesterday, very important, I believe, for our work, but also for many others, is the glossary, the One Health glossary. Over 1,000 items with a harmonized terminology to help the mutual understanding between sectors. And there we performed a pilot study together with ECDC, in fact, to evaluate the glossaries, also on the product that we produced, the One Health Zoonosis Report. And as a result, a glossarification web service was created. And this web service produces a tag cloud and a table of terms with all the available definitions that are used and that can be included in the surveillance report, so can be reproduced and understood by the reader. So this allows any end user to synchronize the terminology in the documents and the reports by the definitions given by EFSA and ECDC that often actually come from legislation. And also in turn it can be used by EFSA and ECDC, by our staff, to check if the terms used in the document are aligned with the legal definitions. A second important product developed by Orion is the CRAC that I mentioned yesterday, the One Health Consensus Report Annotation Checklist, a mouthful. This one gives recommendations on what meta-information should be provided and how to structure it. And this CRAC, the One Health CRAC, was extensively validated and improved and tested against Salmonella and Campylobacter pathogens, again in several One Health reports of EFSA. And this meta-information, in fact, enriches our data, EFSA data, published on the EFSA Knowledge Junction, and helps, again, the users to understand the One Health data set and how to operate and integrate it. And the beauty is that all these tools are available online for free, publicly available. For example, through the One Health Linked Data Toolbox box that is maintained by the BFR and with whom also we have a framework agreement in place with EFSA. Then the Cohesive project, Kitty Maassen was here yesterday, who started there, that aimed to strengthen the collaboration between the human and veterinary sectors, and especially on the risk analysis of emerging zoonosis in member states, in the countries. And there I would highlight the capacity building that was triggered by the Cohesive project in and between the countries, the member states. For example, by developing the decision toolbox, the support tool, that helps risk assessors to decide which risk assessment is best suited in their circumstance. Another one, for example, where we worked closely with Kitty was, and with MedVetNet Association, also the workshop in the pre-accession countries, for example, on One Health. So Cohesive designed and tested quite a number of open source, a platform also, which is called the Cohesive Information System, the Cohesive Prototype Information System, the CIS. And EFSA was mostly involved during the development of the CIS to ensure the compatibility with the EFSA standards, with the EU standards. The CIS allows to store and to analyze and, importantly, to integrate the NGS data and the related metadata of pathogens from different organizations of a country and between countries. And there 3 pilots were run where EFSA again was involved to ensure that this integrated system is compatible as much as possible also with the data collected at the EU level. And in fact, just last week, EFSA organized, together with the EU reference labs, a whole genome sequencing meeting on the Science Meet Policy Conference in Parma. And this conference, again, presented from the technological perspective the status of the implementation of the One Health WGS approaches in both in the EU and the member states, and the progress on the harmonization and standardization, and the barriers still existing in exchanging this data, and reflected obviously on the possible solutions to move the data sharing forward. Then lastly, the B1, we just heard about it earlier this morning, where I would mention the One Health Sequencing for Surveillance Handbook, which is an excellent training material both for internal and external stakeholders. The report tree we heard about, and we would be actually happy to integrate it also in a web application, because the work done by the different actors there, and also BFR and the Status Serum Institute for the harmonization structure of this metadata, provides for a very good interaction with our system. Finally, the matrix. Matrix built on earlier projects and delivered quite a range of very useful tools, also very close to our work, like the One Health EpiCap tool, the roadmap to develop the national One Health surveillance, and the interactive guide to develop multi-sectoral surveillance systems. And we are, again, particularly interested in tools related to emerging threats, as well as the role of wildlife in the emergence, and as well as the risk assessment and modeling methodologies. So through all these projects and many others that I didn't mention, from EFSA, I would like to say that, in fact, the One Health EGP really contributed by improving surveillance, data sharing, analysis, and the integration of that knowledge to build the One Health capacity in Europe and transfer knowledge. And the beauty, I believe, is really that it's all publicly available through tools and accessible to anyone. The big challenge now will be obviously to implement it all at national and EU level. There, I think we still have a long way ahead. I think we will need to continue to invest in research and investment, through research and investment, also in the future, hopefully also under the new framework program. Finally, I would like to thank also my colleagues in EFSA, who have been liaison with the different projects and will continue to be co-actors of One Health. Thank you very much. Good luck.
Well, thank you very much. Great to hear how the outcomes are actually used in the field. Our next speaker is Ole Heuer, who's joining us online. Already introduced yesterday, Ole is the leader of the section of epidemic-prone diseases at ECDC. So, Ole, the floor is yours. Welcome.
Thank you. Do you hear me well?
Yes.
Thank you. So thank you for inviting ECDC again to this second day of the meeting. As I also mentioned yesterday, our main focus, also in line with our strengthened mandate, is to assist the member states. And in that whole area of One Health that we are now re-embarking on, I think that this project in general paved the way in many aspects. The work that is in front of us to, as I also mentioned yesterday, implement the One Health concept among the agencies at EU level and then in the member states will be helped and has been facilitated, I believe, substantially by the activities through this project. There are a multitude of things that are useful both to the EU agencies, but certainly also to the member states. I think that we can say that the deliverables of the project, they fall in two big groups. And one is more interesting, I think, to us at EU level, and that is the part where you are providing or have provided new tools, new methods, new concepts. And the other part where you provided a lot of new knowledge through research and surveys and so on. That, of course, also has a value in itself, but in our role to strengthen the member states' ability to counter crisis and to manage the public health, to improve public health, they're the methods and the techniques that will or processes that they need to implement. Any new thing on that is the most useful for us to work with the member states with. So the knowledge acquisition, I think, is important, but as now the more the structural tools are more important to us. Collaboration, I think there you have paved the way very good. I mean, the involvement of so many institutions, agencies in 22 or at least 20 EU countries, 22 countries in total, I believe, it makes it that you have already been working now on the One Health concept very much in those countries that we are set to work with. For the research and training, there's no doubt that all the PhD projects and all that, I mean, you have put an investment in One Health capital in the member states that we can now benefit from, and the member states will benefit from. The efforts regarding response to emerging threats, I think, is also something where this project has provided something that not only is useful for One Health, but the interoperability between the sectors that will help in any future crisis. So it's the benefit spills over in other areas than just One Health. And for the harmonization of approaches, I mean, this is a problem when we talk about databases, comparability of data. That is an area where we constantly face these problems, that we have a wealth of data, but it is very difficult to use them in an integrated way. And we have already long experience with that through collaboration with EFSA and EMA for instance, on the JACRA reports. And there we know already that this is difficult. And I saw deliverables here that could help us in that direction. And then the general improved preparedness of the member states to withstand, that will simply help their resilience in times of crisis. If I should mention specifically where we see in the individual projects where there is something that ECDC can embark on and can make useful, and this was also communicated in the interview we had with the project management, and I think probably by now the interview round with all the EU agencies has been completed. So if we start with the matrix. Especially the methods to evaluate the One Health capacity in the member states is something that we would like to look into. The strengthened mandate of ECDC puts the task on us to make a large number of country visits in the member states where we are to evaluate their capacity in public health. And there, of course, evaluation of surveillance capacity is an important aspect. For harmony, as I mentioned before, the harmonization and compatibility of data sets is a problem that we knew that from the past. And the more databases, the more advanced data, also molecular data that is emerging, the more we face this problem and struggle to interpret or make recommendations based on the analysis that we can perform. And that also goes for the member states. In care, the improving the for risk assessment and the tools for outbreak detection is the earlier we can see the threats before they are coming, I mean, the better prepared we are. And I think this is also an area where we would be interested. For Orion, the terminology and the surveillance glossary, as also mentioned by Stef, is definitely something that we are interested in. I mean, it's obvious, and also in our, as you can imagine, during the pandemic, very intense and frequent communication with the higher political levels at the EU. It is very important that we are very consistent what we are talking about, and that we, as ECDC, are speaking the same language as the other agencies, and the member states are also speaking the same language to the politicians at national level as well as at EU level, and that they understand what we are communicating clearly. So I think that's an important one as well. For cohesive, as I mentioned yesterday, that is probably one of those that where I see an enormous benefit because of the status of collaboration between the sectors in some of our member states. We know that this can improve a lot. As also mentioned yesterday, some countries are well advanced and can immediately jump to an integrated approach where they are making a nice cross-sectoral investigation. We saw that now, for instance, in one of the member states where there were an outbreak of avian influenza virus in foxes. And there are good use of this improved capacity. Then the simulation exercise, as I understand, we will hear more about a bit later. But that, of course, is also something that we are absolutely interested in, and where the outbreak investigations we are conducting with EFSA, which we also learn a lot from. I think this is something for the member states also to be trained in. And then the covering for the SARS-CoV-2 surveillance and the risk assessment, and the focus on the animal-human interface. I think that is important. We just saw that now in the pandemic, although I know that most people probably forgot quickly into the pandemic that this had anything to do with animals, but it had. And that is a strong example of the need for action in that area. We could speculate if a high preparedness had been in place in that to you can say contain the damage or the risk at an early stage, or how would this pandemic have evolved differently? So that are some of the points where we are definitely interested in the outcomes. Then, as Stef did, I would also like to thank those thank you all actually for doing this enormous work, but also specifically those who were in contact with ECDC colleagues and the ECDC colleagues that were your counterparts. One possibility that we also discovered during the talks to the project management, was that ECDC maintains a database of experts, which can then be called upon to be involved in various panels, assessments, whatever projects may come up. And there we would like to encourage participants in this project to be signed up for, if they have time, of course, in the future, to contribute as an expert to this in this expert directory, and then potentially be contacted when there are One Health issues that we in collaboration with EFSA or other agencies need to deal with, and we can use the expertise that you have and that you build up through your work in this project. Then finally, I would say that this project was a good example of how the stakeholders and also the EU agencies were involved. And this has been successful, we can say. But I think that even more successful would be if even earlier on these needs assessments was done, not when the project starts, but even before, when the project descriptions are already, when the call comes out, already there, the gaps should be identified and then potentially filled in an easier, more direct way. So thank you very much, and thank you again for having us in this meeting with you. Thank you.
Thank you very much, Ole. Also, thank you very much for highlighting our contribution to the response and preparedness to the emerging threats, which is something we have been working very much on. We can move on now to our next testimony, which will be a pre-recorded testimony from Peter Hoejskov. Peter is, Peter is a technical officer for food safety and zoonotic diseases at the WHO Regional Office for Europe. He's a member of the WHO Euro One Health working groups, and he's also focal points at WHO for the quadripartite Regional One Health coordination mechanism. So we can play the testimony.
Peter Sosa Hoejskov, technical officer for food safety and zoonotic diseases in the WHO Regional Office for Europe, based in Copenhagen. So first of all, thank you for the opportunity to talk to you here at the final meeting of the One Health European Joint Programme. It's a great privilege to be with you, although it's only online. I would have liked to be there in person, but unfortunately the schedule didn't allow for that. But on behalf of WHO and also on behalf of the broader quadripartite One Health coordination mechanism for Europe and Central Asia, I would first of all like to congratulate the One Health EGP for the achievements and for the successes you have obtained over the past years. I think the One Health EGP has provided a very good example of how to operationalize the One Health approach and how to foster sustainable and effective collaboration across sectors, across different groups of stakeholders, and also across national borders among countries in our region. I think you have come a long way. And we at WHO Regional Office for Europe, we have been very much inspired by the work of the One Health EGP. And we have also built on the lessons learned to guide our work with member states and with partners on how to operationalize the One Health approach. The WHO Euro has had several opportunities to engage with the consortium and to benefit from your work. Back in 2020, the One Health EGP joined the WHO Global Outbreak Alert and Response Network, the GORN, and disseminated its calls in your cross-sectoral network and gave input to the GORN strategy for 22 to 2026. The One Health EGP also provided input to the compendium on good practices on One Health that we have been putting together over the past year, and to the roadmap that we have developed on antimicrobial resistance for the WHO European region from 2023 to 2030. This is a roadmap that we will launch at the regional committee later this year. And at the global and at the regional level, the tools that have been developed by One Health EGP have been included in the surveillance and information sharing operational tool under the tripartite zoonosis guide. And in 2021, the consortium joined the first dialogue of the partners platform of the quadripartite regional One Health mechanism. And this is a platform we intend to develop and to become a more active instrument for coordination of technical support to member states. So, although the One Health EGP is now coming to an end, we hope our collaboration and our engagement with many of you, either as a consortium in some whatever format, or with you as individual partners, we hope that continue. So operationalizing the One Health approach remains to be a key priority for WHO, and our successes depend on our ability to work across sectors, disciplines, stakeholders, and borders, and with our various partners. And we look very much forward to that and hope that can continue in some format. So with that, I wish you a very successful final meeting in Paris. And again, thanks for the opportunity to talk to you. Thanks.
Okay, thank you. So this was just one example, but it really speaks for our engagement also at the regional and global level, which is something we haven't talked about yet in this meeting, but this also existed. Now I think it's time to move on, and I would like to welcome our first speaker that will talk about the simulation exercise, Ann Lindberg. And welcome. Ann Lindberg is the Director General of the Swedish National Veterinary Institute, Professor in Veterinary Epidemiology and former head of the Swedish Zoonosis Center, as well as State epizootiologist. She's a member of the PMC as well as the POC of the One Health EJP. And the floor is yours.
Thank you. And no, I'm not state epizootiologist anymore. I was for a couple of years. Now I'm only Director General and leaving the tough work to my colleague Carl Stoll, who is very busy now because we have detected African swine fever in Sweden. So, thank you. So here is my presentation, and we can. Well, I was sort of. Anna said a few words about the SIMEX exercise yesterday, and I will try and make a kind of recap, retrospective recap to what led up to the SIMEX exercise, and then move on from there. So next slide, please. Oh, of course, it's in my hands. So why a simulation exercise in a project funded under a research program like Horizon? I would say that this slide tells it all, because it's a picture of our consortium, where we are a consortium of actors that have a societal responsibility to act upon infectious diseases and everything and the consequences that they might cause. And this is a huge investment from the Commission in us, and we have made that investment ourselves as well. So we're coming together to develop this joint preparedness to deal with challenges that we know might arise. So that's the why, and to have a simulation exercise that tests that capacity is a kind of a proof of concept of what we have achieved. And I would also like to link this back to our strategic research agenda, because when it comes to the part that is about integration, there is a table in there where there is this overarching vision of one European surveillance community, that we are working as one to deal with these challenges. And you've seen this integrative matrix where all the projects, the integrative projects, were conceived from the idea that we have places where we meet in the borderline between public health, animal health, and food safety, where we have these challenges of collaborating, and that's what the projects were conceived around. So Orion, we had Cohesive, we had Matrix, we had One Health Harmony Cap and Care. And then the last one, where the overarching objective is that we should have a good capacity to intervene in all member states. That was still lacking after the second call. So this was lying under the objectives for Work Package 4 to strengthen the prevention, the preparedness, detection and response of the EU to all these threats that One Health EJP has been working on. And so the timeline for conceptualizing SIMEX really was how it came to be and how it grew. So we had this second call in October 2018, and quite soon after submission of these first calls for interest, where we didn't have any for this integrative activity 2.4, sharing best intervention practice with twinning and simulation exercises. So there was no consortium taking this task on board. And that meant also that, well, we had some money, we had an ambition that was up for discussion, what to do with this opportunity. And I myself was in contact with ECDC already before the One Health EGP was launched, and that contact was then taken up again in early 19 to, I was in contact with Paul Riley, who is very experienced in arranging simulation exercises. And he said, well, I'll be happy to help if you would like to do that. And I stepped down. I was previously involved in Work Package 4, as Karin replaced me. And the project management team and Karin took on this idea and moved it forward. So in the end of 2020, this idea was once again presented to the Program Management Committee and the Program Owners Committee, and included eventually in the work plan for 2021 and 2022. So the project was set up early 2021. Anna came on board, and all the people around her started working on engaging also the people from within the project team. And then the project was initiated in September 2021, and also, as Anna explained yesterday, ran until December 2022. So what was sort of important parts that the project management team would put forward was that, okay, a national level should be hazard of high relevance. It should test this joint One Health response. It should include using tools developed in the One Health EGP, and then also to use ECDC's manual for simulation exercises. As Anna said yesterday, this was really a project where we had use of the stakeholders rather than them. We are doing something for them. This is the aims and objectives of the SIMEX, to practice the One Health capability, capacity, and interoperability of the authorities in public health, animal health, and food safety. And the focus areas, of course, they were chosen very much on what we know. These are the tricky parts when we start collaborating, actually knowing each other's roles and responsibilities, knowing each other, sharing data, and also communicating together. So these were very, I would say, low-hanging fruits and good capacities to test in a simulation exercise. And then there was also an opportunity for each country, because there's a huge variety between the countries and where they are in these capacities, but also to sharpen some objectives or inject some of their own ambitions. So very briefly, also, so national level, this is a voluntary exercise. So because it was not sort of a consortium applying to do this, the project team had to engage the consortium instead, which was sort of coming from the other side. And there's a lot of work also going into, getting countries on board, getting the teams on board in each country, and so on. And also to create a scenario that was relevant to all the countries and, well, all the sectors, perhaps easier, but all the countries and their varying preconditions. Was also a challenge, of course, to satisfy everyone. But at the end of the day, 11 countries came on board, I think 42 institutes, 255 participants, where not only representatives of all the sectors, but also inviting national important partners to come on board in this exercise from governments and other institutes and so on. And last, this picture of the organization with the project team at the core, and with a fantastic help from the advisory board, which also had our multilateral stakeholders on board, and EFSA and ECDC, very engaged groups that I was also happy to be part of. We had the SIMEX steering board here on stage yesterday. And then, of course, the engagement of all these national exercise leaders that were responsible for pulling things together at the national level, representatives from all the sectors, and last but not least, the local evaluators, who were very important for taking on the experiences from this exercise into what we have learned and the lessons learned, and also doing this like after action review on the very day of the exercise. So this is just to give a big thank you to the SIMEX project team, several here in the room, and for their huge engagement in pulling this off, which was a quite complex exercise, but that we had excellent output from. And I mean, some of the take-homes for us, of course, is, yes, this is a really good way of for adoption, creating dissemination and adoption of the tools developed. We have already picked up Food Chain Lab in Sweden. It was a great way of onboarding junior experts to work together with senior experts in an outbreak situation. And also for us in Sweden, learning how to arrange a simulation exercise is a very valuable core capacity of our institute. So thank you very much for this.
Thank you very much. Oh yeah, sure. You could join us on stage. Thank you very much. Very ambitious exercise. Now let's see how it went. So our next speaker is Matteo Gradassi. He's a veterinarian with expertise in food safety and animal health, and is working at the official veterinary laboratory of IZSLER. IZSLER is an Italian health authority. Matteo joined the SIMEX project as local exercise leader for the Italian SIMEX team. So the floor is yours.
Okay, thank you, Ludo, for the introduction, and good morning, everyone. I would give my speech on behalf of the All Italian Group and the SIMEX Italian Group, and of the national exercise leader who couldn't be here. I was the local exercise leader for this SIMEX exercise. And my presentation is about the perception and outcomes of SIMEX in Italy. And in Italy, SIMEX exercise was conducted in May 2022. And as you can see in the project diagram on the right, the Italian SIMEX team met in preparatory meetings in order to adapt the scenario to the Italian context and to the peculiar national health system structure. And SIMEX was conducted simultaneously in 3 different venues in Italy and in 3 different subgroups, each one coordinated by one LCGP partner. So ISS in Rome with expertise in public health and food safety, and 2 IZSLER in Brescia and IZSAM in Teramo with expertise in food safety and animal health. So other contributors to the events were the Italian focal point for ECDC, the National Reference Laboratory for Salmonella, which is based in Veneto region, and an expert for Food Chain Lab web tool application, which was used during the exercise. And during the conduction, several online sessions were held between the 3 groups in order to discuss the main topics of the injects and share perspective, views, etc. So I can say that right from the start, a great interest in this simulation exercise was shown by the relevant authorities, and we had participants from the regional health authorities, the local ones, but also universities and IVS, so the official laboratories. And we had an high attendance with a total of 40 participants in Italy, experts of the different sectors, so food safety, but also public health. Animal health was less represented because there was a real-time emergency at the moment. We had 1 communication expert and also junior staff in order for training purpose. Moving to the perception of SIMEX in Italy, the post-exercise survey revealed a high positive opinion on this SIMEX training. And I have given 2 examples of the qualitative analysis of the post-exercise survey feedback. As you can see in the first diagram, almost 80% of participants increase their knowledge about roles and responsibilities of the other sectors. And I think that is a really, really important point. And 77% of participants favorably evaluated the Food Chain Lab web application tool for improving in tracing and hypothesis generation. The findings of the post-conduction service are summarized in this figure, and from the local evaluator perspectives and from the participant perspective, we have the need to enhance preparedness through training, like simulation exercises, in order to achieve a better knowledge of the whole picture, so the others and of the process. And also several needs were mentioned, such as the need for data sharing, the need to improve communication, for harmonized procedure, and to strengthen information system to face underreporting of cases. And I would also highlight the importance of building working relationships to increase the cross-sectoral cooperation. So, as the outcomes, several needs were addressed by SIMEX, which was beneficial for bridging across sectors and for improving data sharing routines, because it reinforced networking, interpersonal relation, and increased trust among team members. It led to a better understanding of role and mandates and encouraged interoperabilities of authorities in public health, food safety, and animal health. And I think so SIMEX highlighted the additional value of applying the One Health approach to tackle zoonotic threats. An important outcome is that relevant authorities have shown a great interest in implementing further activities like this one, and such as response simulation exercise to test and to familiarize with the procedure in place. In fact, we had an example of a review and improvement of a regional procedure for the management of foodborne outbreaks, to meet the need of integrating the communication strategies into procedure, and to activate the team of experts at an early stage of an outbreak, and to establish a routine of meeting and to implement rapid risk assessment during a foodborne outbreak as well. And another important point is that a more efficient case reporting software was realized in order to be more user-friendly, more intuitive to collect data. It was really useful and is going well. So, as New Year's resolution, we would like to establish an interinstitutional agreement among ISS and IZS for the purpose of giving continuity to the SIMEX and experience and to meet the need of training in peacetime. And in future training, we would also like to explore additional aspects such as agroterrorism and agrocrime simulation exercise to build resilience against them. And also, we would like to include the environmental health sector in a holistic One Health approach in the simulation exercises as well. Here, two examples of dissemination activities. We participated with an abstract at the National Congress of Italian Society of Hygiene, Preventive Medicine and Public Health in Rome. And I participated at the International Conference, Global Conference on Emergency Management, which was here in Paris in April 2023, with a poster contribution about the Italian OHEJP SIMEX experience. And one scientific publication on this experience is in progress. Finally, I would really thank and acknowledge the whole Italian SIMEX team. So ISS with the national exercise leader and the local exercise leaders as well, and the other partners. And obviously, thank you for inviting me and to have the privilege to be here. So thank you for your attention.
Thank you very much. Particularly interesting to see how this exercise really kickstarted additional activities across the agencies. Okay, so we have our last speaker with regards with the simulation exercise, Cristina González Pérez. She's a virologist currently working at the Finnish Institute of Health and Welfare, THL, and a fellow of the ECDC program on field epidemiology and public health microbiology. Cristina, the floor is yours.
Thank you. And good morning, everyone. So I want to close this part on the SIMEX today. Thank you to the organizers for inviting me to join these two days of your final meeting. It's been very interesting and very nice to meet many of you here. So why am I here? So today I want to show you, give you some insights and reflect on some of the lessons learned from this exercise that they were introducing already. So Anne already explained about this exercise. So as you know, SIMEX was launched to assess and improve the collaboration between public health, animal health, and food safety sectors. And basically, as they were already mentioning, the main aims were to promote the intersectoral cooperation and also to demonstrate the added value of using the One Health approach during outbreak situations. So when SIMEX was completed, 1 year later, more or less, I came into this project and I performed individual interviews with some of the countries that were participating, basically to assess the impact of the exercise, the actions that were taken, or the challenges that were addressed during the exercise or the implementation. So what I did is that I selected 4 countries from the participating countries, and in total, I've recruited 12 local exercise leaders and national exercise leaders representing the 3 sectors. So we aim for a geographical and sectoral representation with this sample. So these participants were invited to participate in an online interview. The interviews were scheduled for 1 hour, and they were semi-structured because they were based on a questionnaire that the participants received before the interviews, together with an informed consent. So to prepare these interviews and to then be able to analyze this information, I tried to identify different themes that could be interesting to address after the exercise. So what I did for that, if it's working, not really. Now it's coming. No, yes. So what I did for that is that I went to the evaluation survey that all participants fill out after the exercise took place. And then I looked through these questions and I tried to identify what would be the themes for our interviews. So one important point that I wanted to address and was not previously addressed in previous reports was how was the perception from the different sectors about the exercise. So when I looked at this evaluation survey data, here you can see when the participants were asked if they found the scenario realistic, relevant, or if the scenario covered all sectors. As you can see that the animal health, depicted here in red, showed less agreement with these statements. So this was something that was discussed during the interviews together with other topics. So actually, during the discussions, indeed, the perception was that the animal health may have played a minor role during the exercise. There may be many reasons for that, but I want to quote one of the participants here. They said, the exercise did not represent what we truly understand as animal health, but focus on public health and food safety. Previous exercises of this type have included the construction of a surveillance system for the disease in question, and it has worked to boost the participation of this sector. Because one of the points also was to address how they could feel more involved or engaged. On a positive note, this sector felt that they really established better connections with the other sectors, which was one of the main objectives of the exercise. Now they experience stronger communication, they are invited to meetings or they share data. And in general, from all the sectors, actually, they all agreed that meeting face-to-face, when possible, for them was really valuable to establish the roles of the other people and to establish stronger connections. So one of the other themes that I wanted to address was what was the impact of the exercise and what were the challenges that the participants maybe encountered when they tried to apply this approach to their to an outbreak situation in this case. So one of the things that came quite often in the interviews, and that yesterday actually was already mentioned here, is the need for political support and the need to involve actors in higher positions. So I quote here, when it comes to outbreak investigations, the decisions are taken at a higher level, and unfortunately those were marginally involved in the exercise. Also, involving these higher positions or other stakeholders would help to lead discussion towards resources, budget, what are the decision-making capabilities. So, for example, one of the questions that came during the exercise is who is going to pay for this? And some other point that I wanted to raise is that some member states, even if they showed high interest in applying this approach when they come to investigate outbreaks, they feel that they still don't have an action plan. So, for example, here I quote, "We're still at the stage of talking and not acting, and for this someone needs to lead the change." So the last topic I want to highlight here today is what are the future perspectives on this kind of simulation exercises? What worked very well for the countries and what could be improved? So something that worked very well is adaptation to each country's situation. As Matteo was mentioning, not only because they have different internal organizations or structures, but also working language is very important when it comes to this kind of investigations. The same way, using a common terminology should be considered, as we were mentioning during these 2 days. If we want to have an interdisciplinary team, we need all to speak the same language. And then something that is very important and has been also very highlighted is the dissemination of the conclusions, results, and recommendations, and this could definitely help implementation as well. And a last point that I want to raise is that many of the participants raised this point, actually, that they think that in the future something very interesting would be to perform after-action review exercises. And I want to cite here, the scenario was well presented, but the actual outbreaks have more challenges to address. Most countries are aware of the One Health approach, but may encounter organizational obstacles. So working on real challenges to be improved and identifying weaknesses would be of high value. So just to wrap up, all sectors were satisfied overall, even if, of course, maybe the animal health felt less involvement, but one of the possibilities would be to consider other activities for them in these future exercises. SIMEX resulted in very relevant cross-sectoral work and discussions, which was one of the main points of this exercise, and also something to be aware or to take into consideration would be the establishment of a routine of meetings for continuity also in peace times, which is very important for these kind of situations when they come. For implementation, I just want to mention again, it's very important to show the value of this approach to boost political will to other stakeholders, to involve actors at all levels, and disseminate the lessons learned may help. For future exercises, adapting the scenario is crucial, was proven very valuable, and the performance of after-action reviews at national level would be also something very interesting. So just to finalize, as we were mentioning already, with enough institutional support and with enough investment, simulation exercises like SIMEX are greatly contributing to create or strengthen these collaborations, to create new communication channels, also to maintain good practices in peacetime when there is no emergency situations, and they contribute to preparedness and anticipation. So I would like to thank you, and also the SIMEX project to allow me to participate in this interesting thing. Thank you.
Thank you very much. Yeah, you can join us on stage, especially for highlighting the challenges and future perspective as well. Okay, now we can move on, and we move to a completely different kind of outcome regarding our workshop on institutionalization of One Health. And I would like to welcome on stage Dolores Gavier-Widén. She's head of Department of Pathology and Wildlife Diseases at the National Veterinary Institute of Sweden. And Dolores works mostly on wildlife health surveillance, and she specialized on infectious diseases of wildlife. So Dolores, the floor is yours.
Thank you very much, Ludo. Okay, my pleasure to be here. Thank you very much for this opportunity. I am the Deputy Leader of Work Package 7, working on sustainability, and the leader, Stefano Moderator, can unfortunately not be here today, but he was also the leader of the work to prepare and conduct the workshop on the institutionalization of One Health and also on preparing the roadmap. The workshop took place in Brussels in association to the Stakeholders Committee meeting. Stakeholders were invited, and including the PMT, there were about 17 attendees. And this is a summary of the program, and we had a keynote presentation from Sustain, a project of the One Health PhD, a PhD project, panel discussion. We presented activities of the One Health EHP towards institutionalization, a roundtable discussion, and the conclusions and proposal of the roadmap document. Among the attendees, health was highly represented, in particular public health, veterinary health, to a lower extent food, and many other sectors as well. So this was a wide representation of many different sectors and disciplines. Our keynote presentation by Sarah Humboldt-Dachroden, who was a PhD student working on this project on the institutionalization of One Health. She looked at the research questions of what are the key institutional drivers and constraints on the effective implementation of the One Health approach. Her findings described then cross-sector collaboration challenges, One Health strategy, and the meaning of One Health. I have been asked to be very fast, as you have probably noticed. We had a panel discussion on the state of play of One Health institutionalization, where the panelists were given some questions beforehand, and then they prepared their statements with representations from Denmark, Henrik Ullum, from Sweden, and Lindberg here, from Italy, Umberto Agrime over there. And the objective here was to scan the approaches used in the different countries and to identify and highlight the major hindrances in the implementation of One Health, and in particular with focus on public health issues. These were the questions that were presented then to the panelists, and the conclusions were, among others, that it was a lack of inclusion of the environmental sector, an absence of legislative framework, and also of ad hoc investments. There were obstacles to the establishment of the effective cross-sectoral collaboration, lack of awareness of the benefits of some of the strategies, of cross-sectoral integration was perceived sometimes as an invasion of sector-specific domains. On the more optimistic side, then all the participants of the workshop were asked to brainstorm and just mention keywords that characterized the One Health once it is implemented and working in the really ideal well. Everything is working fine. Okay, how is it then? Here you see some of those keywords: collaboration, communication, trust. These are really the descriptors of the One Health in place. The activities of the One Health EHP, there were components of the institutionalization of One Health then were presented, or there could be components once One Health is implemented fully. And again, I have no time to go through them. I go directly to the roadmap for the institutionalization and the discussion that took place with the participation of all the participants of the workshop now. Again, a sort of discussion and brainstorming as a first step to identify and prioritize, scanning for sectors to be involved. As a second step, to develop a One Health plan, setting the rules and the flow of data and information. A third step was facilitating and implementing transdisciplinary ways of working. That means establishing a common language, which has been mentioned before, harmonizing method and protocols, and developing the right IT platforms, leading to building a sustainable and impactful engagement. And here was plenty of discussion about data and open data and trust, leading finally to the establishment and adaptation of and the funding of governance mechanisms. And here we include then the identification of roles, identification of funding sources, and then having in place the right legislation that is needed. And there was plenty of discussion on data. Again, unfortunately, no time to go through this, but data, sharing data, open data, fair data was identified as key in the really application of One Health. And finally, a process for the institutionalization then was designed where we need to prioritize the sectors to be involved, design the plans, clear rules and responsibilities, the flow of information, leading to defining policies for data as fair data, implementing tools, plenty of them in the One Health HIP portfolio, to encourage the development of education plans on One Health already at early stages of education, defining common strategies to advocate for the One Health approach, and this ideally to be mentioned even in legislation. This was a quick rush through the institutionalization workshop. Thank you.
Thank you very much, Dolores. I think a report is available as well. So
yes, it is.
In case more. So we are running so late that at this point we might as well take just one question. So if there is any question from the audience. No?
They ask if there's coffee.
I think after the next session there will be coffee. Okay, thank you very much.
Important question. Yeah.
Thank you very much. Please, one round of applause for our speakers, and then we move to the next session.